Hello, everybody, and thank you for attending today's webinar on how TCM Acupuncture can assist with conception. Okay. First, before we start the webinar, please let's start with gratitude. First, I would like to start with a land acknowledgement because we're in Toronto, and in Toronto we have a lot of immigrants and international people who are not necessarily born in Canada. So I would like to acknowledge that the land we're meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and it's now home to many diverse First Nations, Inuit, and Métis peoples. I'd also like to acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And I would also like to thank Yoga Mama for supporting me and my practice and for organizing this webinar. And I would also like to thank you attendees, first for attending the webinar, because without you, the webinar wouldn't exist. And I would like also to commend you on venturing into this new world that is traditional Chinese medicine and acupuncture, because I know that for people who are not familiar with it and who don't know what it is, it can be quite scary. First, disclaimer, this webinar is for educational purposes only. It's not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek the advice of your health provider if you have any questions, may it be me or any other health provider. Please never disregard professional medical advice or delay in seeking it because of something you have learned on this webinar. So who I am, who am I? So my name is Aline Yon. I was born and I grew up in France. I'm of Chinese and Cambodian descent. I immigrated to Canada in 2016. My educational background, I have a bachelor's degree in life science, and then I went into grad school. So my bachelor's degree was obtained in the University of Paris in France, and then I went into an engineering school in France where I got my master's degree in biotechnology management. Afterwards, I worked for 10 years in the pharmaceutical industry, where I was leading the launch of new drugs, and I was foreseeing, leading and organizing everything from research, clinical trial, regulatory affairs, until marketing and launch. And then after 10 years, I decided to change careers, and I went back to school, to traditional Chinese medicine school, where I earned my acupuncture diploma. And I'm now a registered acupuncturist practicing traditional Chinese medicine. So what is the content of today's webinar? First, we'll briefly explain what is traditional Chinese medicine, and then also how traditional Chinese medicine can help you in your fertility journey, and also what you can expect from an TCM acupuncture treatment. If you have any questions, please feel free to type them away, and I will answer them at the end of the webinar. So what is traditional Chinese medicine? When you look at this image, what do you see? So roughly, some people would see a rabbit. So here you can see the 2 ears of the rabbit. Here you have the eye of the rabbit. Here you have the head of the rabbit. And here you would have the nose and then the mouth of the rabbit. Other people, they don't see the rabbit at all. They would see a duck. So how could they see a duck? Here you have the head of the duck here. Here you still have the eye of the duck. And here, instead of the ears of the rabbit, people would see the beak of the duck. Does that mean that people who saw the rabbit are wrong? No. Does that mean that the people who saw the rabbit are wrong? No, it's just a different perspective, but the image, this drawing is actually the same for everybody. It just depends which angle and which perspective you are looking at this drawing. Now, maybe you recognize this picture. It's at a seafront, and maybe some of you are familiar with the sea. And when you're familiar, like more the ocean than the sea actually. And when you're familiar with the ocean, you would know that at certain times you have the high tide, and during that time, the water level is quite high, and you have to be careful and not go on the rocks because you might lose your foothold. But when it's low tide, just like now, for instance, the rock are uncovered, and you even have tide pools, and inside the tide pools, you would have small animals. And it's when it's low tide, it's when you can go out with your bucket and dig some clams and mussels. That's a tide. So if you are in traditional Chinese medicine, how would traditional Chinese medicine look at the tide? How would they study the tide? They would say, well, the tide, you have a high tide and a low tide, and the high tide and the low tide are tied with the moon. So they will observe the different periods of the moon, and then they would record what time the high tide would come, and then they would put a calendar, and they would say, oh, look at those times when you have the high tide, and when it's high tide, you have to be careful and not go on the rocks, otherwise you can lose your foothold and accidents could happen. But when you have a low tide, you can go and dig up your clams. How would biomedicine, Western medicine, look at it? They would say, oh, when it's high tide, we are going to analyze and look at the concentration or the temperature of the water in the tide pools. And when it's low tide, we would also look at the difference of temperature in those tide pools and the difference of concentration in seaweed or clams or things like that. Does that mean that the way Western medicine would analyze and study the tide is wrong? No, it's just the point of view. They want to look at what's going on a microscopic level. And does that mean that how Chinese medicine would look at the tide is wrong? No, they are very practical. They look at the moon, they look at the times where you have high and low tides, and they look at what time you can go and dig up your clams. So you really have two different perspectives, but both of them to study the tide. It's the same for the human body. Western biomedicine study the body in a different way than Chinese medicine would do. And the language is different because it's two different cultures. So if some of you speak another language than English, or if you have learned French, you would know that the grammar and the language is different. And you can't speak French, for instance, with English grammar, otherwise it wouldn't be proper, it wouldn't be right, and vice versa. So how would both biomedicine and traditional Chinese medicine look at those symptoms? For instance, you have a lot of irritability, you are not patient with your colleagues or your family or your spouse or your partner, you turn to depression, bouts of sadness, you have no appetite, you can't eat anything in the morning, for instance. You are under a lot of stress, and for instance, you would have tight shoulders and neck pain, and either you would have irregular menses, or either you have pain during the menses, or irritability or breast distension before your menses, which is PMS. And you would also have infertility issues, you have issues to conceive. So Western medicine, they would go through different systems because Western medicine, they usually cut and analyze. So they would say, oh, if you have irritability and depression, for instance, oh, it would be an issue of the nervous system, or they would send you to the psychologist. If you have no appetite and if you're bloated after eating, oh, that would be a digestive system issue. So they would send you to the gastroenterologist. If you have tight shoulders, they would say, oh, you have a muscular system. So they would send you to, I don't know, the chiropractor or the physical therapist. And if you have irregular menses or and PMS, they would say, oh, it's a a reproductive system or an endocrine system, and if you have infertility, they would do the same and they would send you to those specialists. So you would have seen a lot of people during that time. How would traditional Chinese medicine look at it? Traditional Chinese medicine doesn't cut and separate, but integrate. They say, oh, if you have all those symptoms, irritability, depression, no appetite, you are bloated after eating, you have tight shoulders, you have irregular menses, PMS, and infertility, what does that mean? For traditional Chinese medicine, you would see one practitioner that would recognize a pattern and they would say, oh, we know that pattern, and that pattern is called liver qi stagnation. By the way, the name of the organs in traditional Chinese medicine don't exactly match, actually don't match at all biomedicine. So when we say in traditional Chinese medicine liver, we don't really mean your liver the way biomedicine, Western medicine would see it. So traditional Chinese medicine is actually more than 2,200 years old. Why I would say that? It's because one of the classics, one of the foundation books in traditional Chinese medicine is called Jing. It's the Yellow Emperor's Classic of Medicine, and that book was written more than 2,200 years ago, and it summarizes the theory and the techniques. Actually, some sources say that traditional Chinese medicine existed more than 3,000 years ago. By comparison, when was modern biomedicine, the medicine, Western medicine that we know now, was kind of founded? When was that medicine, when were the foundations of that medicine were put? They were put in the 19th century by Claude Bernard and Louis Pasteur, and you have microbiology and antibiotics and so on. And acupuncture and traditional Chinese medicine works. Some people would say, oh, it doesn't work because it's not scientific and so on. Well, the thing is, you have lots of research done in China. That's why that medicine that is 3,000 years old still exists today, because they retain what was effective and what was working. And you also have a lot of research now in the Western world, and they found that acupuncture and traditional medicine work in fertility and reproductive area, pregnancy, and other areas like constipation, cancer, depression, insomnia, and so on. So now that we have a brief overview on how and what traditional Chinese medicine is, now let's have a look at how traditional Chinese medicine and acupuncture can help in your fertility journey. So, does acupuncture and Chinese medicine help in your fertility journey? Yes, it helps at every stage of your fertility journey. It helps for both male and female factors, which means that usually when I see patients, it's usually the lady who comes, the female patient who comes. But when you have fertility issues, when you have repeated miscarriage, sometimes it's because the genetics are, what they would say, not good enough. But I would argue that the male factor, the father of that baby's genetics, accounts for 50% of that genetics. So when we treat fertility, we have to consider treating both male and female. So it would be you and your partner, and if you are going through IUI or IVF, and if you are looking at a sperm donor, and if you know the sperm donor, it would be a good idea to have a talk with the sperm donor if you know that person, and have them check the health from a traditional Chinese medicine perspective to optimize the sperm cells and optimize the outcome of your fertility journey and have a baby. So traditional Chinese medicine and acupuncture helps in both increasing the quality, but also the quantity, the count of the eggs, but also the sperm cells. So if you have done the test and the fertility clinic say, oh, you have a very low count on sperm or you have a low count of eggs, or if the quality is good enough, don't go into despair. Traditional Chinese medicine can help improve those. In addition, of course, of changing your lifestyle, eating organic food, sleeping more, reducing stress, and etc. Traditional Chinese medicine and acupuncture would also help balancing your hormones, so you have more chances to conceive and have a baby. Traditional Chinese medicine acupuncture would also work on regulating your menses. So you would have regular hormone menses, and so you would have also what we would call enough blood. The blood quality would be good. It would also improve endometrial lining, because one of the factors of infertility would be that the endometrial lining is too thin and the egg couldn't implant. So traditional Chinese medicine acupuncture can help improve that. Maybe you've been told that stress is a big factor in infertility. So acupuncture and traditional Chinese medicine would really help reduce that stress and help your body relax. Why that is important? Because technically, when you're under stress, it means that your body is being threatened. And we have to look at, in the ancient times, when you're under stress, it's because, for instance, you would have a big bear coming at you and eat you. And when you have a big bear coming at you and eat you, all your blood flow goes on your legs, so you can run away from the bears. They would go on your arms, so you can fight and punch the bear, and the energy would go up and out. So they would go on your jaw, so you can shout and scare the bear out. Except that now we live in modern world, so usually the stress is not the bear coming at you. It would be stress from work, stress from this COVID, this little virus we don't know, but we know it's very dangerous. So when people are under stress, that blood flow would go to all those muscles, and why it's important to exercise, so the energy wouldn't be stuck. So when you're under stress, that's why you have shoulder pain and jaw pain. Shoulder pain because you're not using that energy to fight the bear, and jaw pain, why? Because you're not using that energy to shout, because we're in a polite world where we're supposed to be nice with each other. But while the energy is stuck on those areas, on those muscles, while the blood flow is stuck there, the blood flow doesn't go into your digestive system, so you can produce more blood, doesn't go into your reproductive system, so then your egg quality and quantity, or your sperm cell quality and quantity wouldn't be good, because they're not nourished by that blood flow. So traditional Chinese medicine acupuncture would really help reduce your stress, so your body would be relaxed and be more into the conception mode. Because think of it, when you have a big bear coming at you, you are running for your life. So you are in no mood in making babies and have a nice dinner. Or the other way, have a nice dinner first and then making babies. And overall, traditional Chinese medicine acupuncture would also improve your health in general in a more individualized way. Why I say individualized way? So I did work for 10 years in the pharmaceutical industry, and usually, you have drugs, so you would take the same drugs for everybody, and then you would have side effects and things like that. Whereas traditional Chinese medicine, they would be the tailor of your clothes. So you would have clothes tailor-made to you, to your health, instead of just getting the first shirt that you got from the supermarket. So when you have a healthcare that is tailor-made to you, your condition right now at this stage of your life, I would say it would improve your chances of being healthy and conceive a healthy baby. And traditional Chinese medicine acupuncture also looks at you on a holistic way. For instance, my patients, especially the one who are on the fertility journey with me, I always ask them about how they are, what are their emotions, how would they grade their stress level, and I would look at their diet and lifestyle, and on ways on how to improve the whole environment. Traditional Chinese medicine acupuncture also helps and reduces the side effects from fertility medication. So for those of you who are going through IVF, for instance, and they would take fertility medications, they would feel nausea, or they would feel bloated, they would feel irritable, or they would have a big roller coaster of emotions. and they would have insomnia. So traditional Chinese medicine acupuncture would help reduce all those side effects. So your fertility journey would be much nicer. And once you are through the IUI or the IVF, or if you do it naturally, um, not only we need the egg and the sperm cell to meet and become one, we also need that fertilized egg to actually implant into the womb and develop. So traditional Chinese medicine acupuncture also helps in improving the implantation rate of the egg and then increases the success of a viable pregnancy. So how does all that work in theory? What's the theory behind traditional Chinese medicine acupuncture? So first we look at balance. So you all know the yin and yang. So if you work a lot, it's important that you rest a lot too. If you're awake for a long time, it's important that you sleep, for instance. You all know the yin and yang, but maybe you're not familiar with the 5-element cycle of life. So we'll do a little bit of theory, so please hang on with me. And please feel free to ask questions if you have any. So first we have the 5-element cycle of life. So let's start with wood because we are in the spring right now, technically, even if it was snowing lately. So the spring is the wood time. And what is the wood meridian is, so the wood goes in spring. So what does the wood need to grow? We need water to generate wood. And then the wood, when you need wood to burn fire, that's why we say wood generates fire. And then when the fire burns down, it becomes ashes, and then the ashes is the earth, is the soil. And in the earth, in the soil, what do you find? You find ores of metal. And metal, technically, it's ions. And when you put some type of ions together, what do they generate? They generate water. That's why in the 5-element theory in traditional Chinese medicine, we say we need those 5 elements in harmony. So to have wood, we need water. So water would generate wood. Wood would generate fire. Fire would generate earth. Earth would generate metal. So I hope this is clear. If it's not clear, don't worry. So how would we see that in traditional Chinese medicine? So first, the wood meridian in traditional Chinese medicine, it's the liver meridian. It's not your liver organ, it's a function. And what is the function of the liver meridian? The liver meridian, they say it's the controller of the energy. It makes sure that your energy flows smoothly all over your body. And the liver meridian also is the container of what we call in traditional Chinese medicine blood. So the liver meridian would have a big role in your menses, for instance. So if you have issues with menses, the liver meridian is most certainly affected. And what you find in blood, you also find hormones. And what are the hormones controlling? They're also controlling your emotions. So the liver meridian in your fertility journey is very, very, very important. And what affects the liver meridian? Stress. Because when you're stressed out, the energy doesn't flow smoothly anymore, and then you become irritable. So that's why they said that stress is a very important factor in fertility. And when you stress out, you have irritability. So what are the other conditions that would affect the liver meridian? There would be PMS, menses issues, irregular menses, too late, or too short. If you have vivid dreams, like almost nightmares when you sleep, or if you have any pain. I talked earlier about shoulder pain, but you also go for neck pain and jaw pain or any pain in your body. Because in traditional Chinese medicine, they say that if the energy doesn't go smoothly, then you have pain. So then let's say you have the wood meridian that is not happy. So what happens when you have too much wood, when you have too much plants? Then the water decreases. You have less water. And what is the water meridian in traditional Chinese medicine? It's the kidney meridian. I would also, it's not the kidney organs in Western medicine, it's a meridian, it's a function. And what is the function of the kidney meridian is the life meridian. So the kidney meridian would be the meridian that would dictate your vitality, the genetics, but also your eggs and sperm cells. So if you have any issues with the kidney meridians, you would have those symptoms. You have either low count or not so good quality in your eggs or sperm cells. Some of you would also have back pain and knee pain. Others would have issues with too hot or too cold, night sweat. If you have night sweat, please, I would urge you to come as soon as you can to traditional Chinese medicine, because in traditional Chinese medicine, night sweat means the loss of your life essence. And we need a lot of your life essence to make babies. If you also have a weak kidney meridians, then you have urinary issues. So if you go to the toilets and pee, if you have to get up at night to go to pee, it's a kidney meridian issue. If you go to pee a lot, or if you have any urgency or things like that, it's a kidney meridian issues. And if you have mantis issues, that could also be a kidney meridian issues. So we saw that when you have too much wood, you have not enough water. And when you have wood, but not a lot of water to help water and grow the wood, what would happen? You would have dry wood that would go on fire. And the fire meridian is the heart meridian, is the emperor of your body, is the one in charge of your emotions and your soul. So what happens when the wood is so dry that the fire goes blazing? Then you have too much fire and then you can't sleep and you have emotional issues and you're not grounded. And you also have menses issues because in traditional Chinese medicine, the menses would be governed by water, wood, fire, but also earth. The earth meridian is the spleen meridian. So you think of it as Mother Earth, the nourishing earth. So if you have issues with the spleen meridians, then you would have digestive issues, bloated after eating, tired after eating, no appetite in the morning, or no appetite at all. And you would have anemia because you don't absorb and digest your food properly, or you would be tired, and of course you would have menses issues. And another factor in your fertility journey is if you are over 35 and if you have IUI, you're going through IUI and IVF, or if the doctor told you you have unexplained fertility, please do come to traditional Chinese medicine and acupuncture because we could help you addressing those issues. Now, you have decided that you're going to come for an appointment in traditional Chinese medicine acupuncture. So how does it work? First, I know acupuncture means needles, but first thing first, traditional Chinese medicine acupuncture is supposed to be pain-free. First, we use very, very thin single-use sterile needles that we throw away straight away after use. And the needles are as thin as a hair. For instance, in this picture, you can see that there are more than 10 acupuncture needles. It's actually 13. It's a friend of mine who took that picture. So you can put more than 10 acupuncture needles inside the hypodermic needles. So you can put more than 10 acupuncture needles in the needle they use for a vaccine. That's how thin it is. That's why traditional Chinese medicine acupuncture should be pain-free. So either you won't feel anything, or upon insertion, you might feel a prick or it's like a mosquito bite. And then you could feel sensation, like a heavy sensation, a dull, achy sensation, but it's not uncomfortable. Or you could have like traveling sensation, or you could feel warmth or cold, but any sensation would be good, as long as it's not sharp stabbing. If it's sharp stabbing pain, then please tell your acupuncturist because there's something wrong. But normally you shouldn't feel anything wrong. You shouldn't feel pain, and it shouldn't be uncomfortable to get acupuncture. So what happens in an acupuncture treatment? So it's in 3 times. First, I will go, for instance, into your holistic health history. I would look at your physical symptoms, but also emotionals. I would check if you are more anxious, if you're more sad, if you're more stressed out, if you're more angry, because that means something in traditional Chinese medicine. I would also look at your lifestyle, what time you get up, what time you go to bed, and things like that. If you exercise, what type of exercise you're doing. I would also look at your diet because that's important too. And then I would also look at your pulse and tongue. So in traditional Chinese medicine acupuncture treatment, it's the only time in your life where sticking out your tongue, just like that lady here, is not rude, but on the contrary, it's mandated. So of course, with COVID, you would like stand very far away from me, and then you would only remove your mask and stick out your tongue very briefly, and then you would put your mask back. And then we would check your pulse. Just like the lady here, she's putting her hands on both wrists of that lady on the left, and that's how we would check the pulse. So the way we check pulse in traditional Chinese medicine is very different from what you would be used to in Western medicine. And then once I would have all your health history, I would check your pulse and your tongue, and I would have a diagnosis. Then we would go into your treatment. So I will perform acupuncture. So that's me and the patient. As you can see, the patient doesn't look to be in pain. But on top of acupuncture, I could also do Moxa. It's in moxibustion. So it's burning a mugwort to add more heat in your body. It could be gua sha. Some of you learn gua sha, it's scraping or cuppings. Maybe some of you remembers the octopus red marks on Michael Phelps when he was doing the Olympics. I would also give you lifestyle and diet advice because, again, traditional Chinese medicine is a holistic medicine. Some of us would do Tuina, it's a type of Chinese massage. My colleague Teresa at Yoga Mamas, she could also prescribe you herbs. It's not my case, not yet, but Teresa can do that. And my colleague Ingrid, she's really good in Tuina massage. I'm not a good fan of massage, but if it's your thing, then I would really strongly advise you to see Ingrid for massage. And then once the needles are in your body, what's happening? I would dim the lights and then put a nice relaxing music and then leave the room. And for around 20 minutes, you will just relax and rest. It's like having a nap. I have a lot of patients who actually fall asleep or at least have a nice relaxation time during the acupuncture treatment. So, you know how an acupuncture treatment um, happens. So after those 20 minutes or so, I would come back and remove all the needles, and then you would be free to go home. And then I usually advise you to take it easy for the rest of the day and go to bed early. You feel like it, you feel so relaxed that you would be sleepy, and drink warm water to help flush any toxin that were released during the treatment. So what would happen to your body after acupuncture sessions? So you look at earlier, you would have all those symptoms that I said would be treated with traditional Chinese medicine. So let's start with the liver meridian. So stress is a big factor. And let's say you have a liver meridian issues, and you would have all those symptoms: stress, irritability, PMS, vivid dreams, shoulder pains. You could also have dry eyes. By the way, you could have a mix of all those symptoms, not just the liver meridian. So, but let's say the liver meridian is affected in your health. So what would I do? Acupuncture. And what would happen after you've had acupuncture? So I would be working towards making you feel more grounded, so you wouldn't feel as much stressed out as before, that your menses would be pain-free, no more PMS, no more breast distension, no more big cramping during your menses. You would have a restful sleep. So when you go to sleep, you go to sleep and you get up feeling rested and not traumatized by your dreams, and your body would be pain-free. So no more pain in the shoulder, in the legs, or anywhere. So if you have heart meridian issues, what would happen with traditional Chinese medicine and acupuncture? I would work on getting you easy, restful sleep. I would work on having your heart at peace, so you would be content with who you are, with your life, and with your circumstances. And I would also work on smooth menses. Forgot the word menses here, sorry. And if your issues with the spleen meridian, I would help on improving your digestion, so you would have a healthy appetite, so you can actually digest food, absorb food, and make blood, so you would have a thicker uterine lining, you have better quality eggs or sperm cells, and better quantity. You would have your energy back, and you also have your smooth menses. If your issues is with the kidney meridian, which is the life meridians, which governs your genetics, but also the central heating of your body, I would work on you getting better sperm cells and egg quality, but also quantity. You wouldn't have any more low back pain or knee pain. You would have a smooth urination. Hopefully, you won't get up at night to pee anymore. You won't rush to the bathroom to pee. You would have a better temperature in your body, so not too hot and not too cold. And you would also have smooth menses. So, with traditional Chinese medicine, acupuncture, in a few words, it would just get you have a better overall health, and it would increase your chances to conceive a healthy baby. So when should you come for acupuncture and traditional Chinese medicine? So you should go as soon as possible. Why? Ideally, you would come 3 to 6 months before conceiving. For difficult case, they would even say 6 months to 1 year. And why we say at least 3 months? Because it takes 3 months for new sperm cell, healthy sperm cells to be produced, and same for your eggs. How often should you come for acupuncture? Ideally, you would come twice a week for the first 2 weeks, and then once a week. I know it's a big commitment, but I would really encourage you to look at it as self-care, because when you come, you feel hurt because you're expressing all your emotions and your stress. You are treated with the acupuncture needles, and then you get your relaxation time with the smooth music, the dim light, and your nap. Because some people, they can't sleep and they can't rest, but with acupuncture they can. It's because we're working on regulating your body so you can come back to a restful mode. For how long should you go for acupuncture? I would advise you to come until every week until you get pregnant. And for those who are going through IUI and IVF, I would go until 1 week after the procedure. Why? Because around 1 week after the egg is fertilized, it's when the egg would implant into the womb, and we want to increase the chances of a successful implantation and therefore a successful pregnancy. That's why I would say come until 1 week after the procedure. And then once you're pregnant, of course, acupuncture, traditional Chinese medicine acupuncture, because you need something tailor-made to your condition, to your body, to your life circumstances right now. It could also help during pregnancy and, of course, postpartum. So here are the tips to manage your stress, because as you might have seen, stress is a big factor in infertility. First, we have free online resources at Yoga Mamas for fertility, yoga, and meditation. So please feel free to go onto Yoga Mama's website and take a picture of that slide, because every Wednesday at 7 p.m. you have a free online fertility yoga. That's worth it. You also have on-demand yoga mamas for exercise, for meditation, for stretch, and things like that, both for fertility, pregnancy, and postpartum. So with this code here, FTBALI2, and you can benefit for 1 month free from the fitness classes. And the link is here at Yoga Mamas on-demand TV. You can find all the information on Yoga Mama's website. And last but not least, I recorded very useful sets of moves. It's called the Meridian Gym. So it's a series of 14 different types of movements to regulate all the meridians in your body, So you would be in better health. So when the energy goes smoothly in all your body, you would be in better health and you have higher chances to conceive. When would you do this Meridian Gym? You would do in the morning before your breakfast, when you're stressed out, when you're tired, and if you need, more energy. So with me, with all the explanations and so on, it takes 20 minutes. So this Meridian Gym is free on Yoga Mama's TV here. When should you not do this Meridian Gym? Not before going to sleep, because this Meridian Gym would give you energy. So before going to sleep, you actually want to wind down. So don't do that Meridian Gym just before going to sleep. You shouldn't do it after food, because after food, your energy should be used into digesting the food and not used to be circulating as everywhere else. And I would also add a caution during pregnancy, because as of now, I don't know what are the effects on pregnancy with this Meridian Gym. So be cautious. And this Meridian Gym personally had helped me a lot when I was in my stressful corporate job. I would, for instance, do it before a big presentation in front of the president of the company and the general managers of all the countries, because I was working at a global level. But each time you're tired because oh, you didn't sleep well, and then you still had to take care of your family and so on, then by all means do that Meridian Gym and do take a picture of these slides. You have access to that Meridian Gym on Yoga Mama's on-demand TV, and it's also on the website of Yoga Mamas. And if you have any friends and that are pregnant or postpartum, and if you enjoy that webinar, know that I do another one on postpartum and how acupuncture, traditional Chinese medicine, can help with postpartum. And of course, you can find all the information on the website of Yoga Mama on the online free events. Now, thank you for attending this presentation. So again, my name is Aline Yon. I'm a registered acupuncturist practicing traditional Chinese medicine at Yoga Mamas. You can contact me at this email, alineyon@yogamamas.co. If you have any questions, and also know that I offer a 20-minute complimentary appointment if you have any questions, or if you want to know if you and I are a good fit to work together in your fertility journey. Know that I'm practicing at Yoga Mamas on Tuesdays and Saturday. If you can't come on that days, or if you don't like my personality, which is fine with me because everybody is unique, know that at Yoga Mamas, there is a traditional Chinese medicine acupuncturist there every single day. So from Monday to Sunday, there's someone you can see. And you can find all the information at the website, torontoyogamamas.com. And if you want to make an appointment, you can either do it online or call this number. Now, if you have any questions, I'm going to answer the questions and look at the chat. Shivani, are you open for appointments during this third wave? Yes, we are, because acupuncturists, we are registered healthcare professionals, so we are considered essential healthcare. So yes, we are open, and I still see patients. So does anyone else have it? Great. We look forward to meeting you, Shivani. If you have any questions, feel free to book for a 20 minutes complimentary appointment, and then we can tell you how we could help you. You're welcome, Shivani. So thank you everyone for being here. I would wait another 2 minutes if anybody else have any questions. And also, if you enjoyed this webinar, know I also do regular webinars explaining traditional Chinese medicine, how it works, how we can live and tune in with the season and so on, for your friends and family who are not in a fertility journey. I have other recorded webinars that you could watch in replay on my YouTube channel. So you just Google on YouTube, Aline Yon, my name here, acupuncture, and you'll find it. Thank you, Tiana. I hope you find it useful. Ich spreche ein bisschen Deutsch. If you are a German-speaking person, I understand more than I speak, but I can brush up my German if it's more easier for you. Oh yeah, by the way, I'm fluent in English, French, and also Khmer, Cambodian language. My Mandarin is just basics, but I'm better in German, so I can brush up my German if I have patients who are more comfortable sharing their health and their emotions in German rather than English. Anyway, thank you, everybody. Thank you, Lorraine. It's great to have your feedbacks. So I think now the time is up and I don't see any more questions. So thank you everybody for attending today's webinar. And please do take care of yourself and take care of adding more joy in your life and more exercise. As you could see earlier, we have this cycle of life that we need to take care of to have life in your life, but also to be able to make life. Have a nice evening, everybody. And thank you, Karina, for supporting me. Good night, everybody. Bye.